Schizophrenia is a disease characterized by deviation in perception, thinking, speech, affect, and volition. Now, what are these things? Perception is how the person perceives the sensory stimuli. So, without any external stimuli, these patients can perceive sensory experience. This is called as hallucination, meaning without any external stimuli, he is hearing something, he sees something, he is feeling something. If the patient has auditory auditory experience, it's called as auditory hallucination. If the person sees something, even if it is not present, it's called as visual hallucination. If the person feel like the crawling of the bug under his skin, even if it's not there, it's called tactile hallucination. Then we have disorders of thinking like delusion, where the person has fixed false belief. Even in the presence of contradictory evidence, the person will be having fixed false belief. He may be telling that I am Ambani, I am Adani, I am so rich and all, even if he is poor. So this is about delusion, that is deviation in thinking. Next, we have deviation in speech, neologia. He may have his own language, his own words, something like that. The neologia, meaning he's creating the new words. Then you may have word salad, meaning he mix up different groups of words like I went to airport to coffee, slept, like this, without any meaning. He mixes up the words. This is called as word salad. This is a speech disorder. Then we have alogia, that is sparsity of speech. If he has open-ended question to the patient, he will not be answering with adequate response, with adequate words, and there will be sparsity of speech. The person may have echolalia. Now, if I ask the patient, how are you feeling? He'll tell feeling, feeling, feeling. Like this, you simply repeat the words without any meaning. This is called as echolalia. These are speech disorders. Then the person may have affect, deviation in affect. Affect means the outward objective emotional experience, the outward objective emotional experience of the patient, which the clinician sees at given time. At present, how the patient is outwardly expressing his emotions. For example, the effect has been classified into normal, increased, and blunted effect. We'll see what normal effect means. If I crack some joke, the patient will laugh. If I tell some bad news, he'll feel bad. That is normal effect. Increased affect means he'll be over dramatic and overwhelming to the jokes and bad news that I deliver. Due to over dramatic, the examiner, that's the doctor, feel overwhelmed by his responses. Then he may have blunted response. If I tell him you got AR1 in NEET PG, he'll be said, oh, okay, okay. The response is very much blunted. That's not the usual response that we expect from the patient. Then we have volition. Volition means it's a cognitive process where a person decides and commit for an action. For example, some medical student sets a goal that he has to crack NEET PG in next 1 year. Then he takes action, initiates the actions like watching marrow videos, doing regular MCQs, and he persists in spite of any life stressors like love failure and other life stressors. He persists even after having the stressors. This is called as volition, meaning a person, it's a cognitive process where a person decides and commits for an action. So any deviation in perception, thinking, speech, affect, and volition is considered as schizophrenia. Now, what is the idiopathophysiciology of this condition, schizophrenia? We have risk factors, that those are genetic risk factors, that are like 22q deletion and neuroregulin. The neuroregulation gene, neuroregulin is gone, so leading on to schizophrenia. NRG1. Then we have some environmental factors as risk factors for developing schizophrenia. Those are maternal infection with influenza, rubella virus, and other viruses, and also having the fetus having mother having any obstetric complications and the fetus suffering from it, and also any stressful life events is a risk factor for developing schizophrenia, and cannabis use has been associated with schizophrenia. These risk factors will lead on to pathological process where there will be impaired neurotransmitter levels in the brain. The dopamine level in the mesolimbic system, if it increases, it causes positive symptoms. In the mesocortical area, if the dopamine level decreases, it causes negative symptoms. We'll see in a while what is positive and negative symptoms. So also the increase and decrease of serotonin levels is been associated with the positive and negative symptoms respectively. The decrease in norepinephrine levels has been associated with negative symptoms. See, these three neurotransmitters are the neurotransmitters that we are targeting while using selective estrogen. Sorry, not selective estrogen. That the serotonin norepinephrine reuptake inhibitors and also the antipsychotic drugs like olanzapine, aripiprazole, and all. In antipsychotics, we usually target these dopamine. So impairment in neurotransmitter level is seen in case of schizophrenia. Then we have neuropathological changes like increase in size of ventricles, decrease in size of basal ganglia and limbic system. Any acute psychological stressors like social stress, adverse life events like loss of loved ones, cannabis use has been associated with acute onset of symptoms of schizophrenia. Now let's go on to discuss clinical manifestations of schizophrenia. According to DSM-5, out of 2 out of 5 of these symptoms should be present for more than 6 months, with each symptom present for significant time for at least 1 month. So DSM-5 says that 2 out of 5 symptoms like delusion, hallucination, disorganized speech, disorganized behavior, and negative symptoms should be present for more than 6 months, and each symptom should be present for significant time for at least 1 month. This is DSM-5 definition of schizophrenia. The delusions we already, it's a fixed false belief, even in the presence of the contradictory clear-cut evidence that this belief is wrong. For example, the person may have that some heroine, like Rashmika Mandana likes him, but I tell him that she recently get married, but he doesn't believe it. So he may have fixed false belief even in the presence of the contradictory evidence. Then we have hallucinations. Some hallucinations we discussed, that is in the absence of external stimuli, the patient is perceiving having sensory experience. Then we have disorganized speech, echolalia, neologia, and all alogia. And then we have disorganized behavior, where the patient will be having impaired clothing and impaired social behavior with others and all. This is called as disorganized behavior. Negative symptoms we'll see now. The positive symptoms are delusion, hallucination, disorganized behavior, and disorganized thoughts or speech. The positive symptoms meaning normal humans doesn't have this. The deceased person has these symptoms extra. The negative symptoms means we usually have good mood. We usually feel pleasurable by following our hobbies. We are usually motivated. This normal person. This deceased person will lose these things. This is called as negative symptoms. Anhedonia is loss of interest, loss of pleasure in doing the activities which was previously pleasurable. Apathy means lack of interest in doing the things. Avolition, we already saw, is lack of motivation and persistence in a particular action. Asociality is the person isolating himself from the social. And affective blunting, we already saw that the patient doesn't respond adequately. That is, current emotional expressiveness is decreased. Alogia means sparsity of speech. These are the negative symptoms and positive symptoms that we see in schizophrenia. We have types of schizophrenia based on the predominant symptoms that the patient is experiencing. If the patient has only negative predominant symptoms, it's called as simple schizophrenia. If the patient has delusions and hallucinations and delusions like persecutory, that the others are trying to kill him secretly, like this, if the patient has delusion and hallucination as predominant symptoms, then it's called a paranoid schizophrenia. This is the most common type. And then if the patient has disorganized behavior or disorganized speech and evolution as predominant symptoms, it's called as disorganized schizophrenia. In this disorganized schizophrenia, the patient will be giggling senselessly. We have catatonic schizophrenia, where the marked motor behaviors are the marked symptoms, meaning the patient will be restless, agitated, and there will be increased psychomotor activity of the patient in catatonic schizophrenia. If patient doesn't fit to these four categories, it's called as schizophrenia undifferentiated type. Next, we have management. We do investigations to rule out any of the organic causes causing these symptoms, which we see in schizophrenia. Investigations, we have neurological examination, where you perform detailed neurological examination, and then we'll to find out organic causes, we do CBC, LFT, RFT, EEG to rule out medial temporal lobe epilepsy and all, CT and MRI to in CT and MRI we can look out for ventricular enlargement and reduced cortical volume, which we see in schizophrenia patients. Next, we have treatment of these patients. Pharmacotherapy, we have antipsychotic drugs like atypical antipsychotic drugs like olanzapine and aripiprazole. We give these drugs for the duration of 1 to 2 years, and if the patient has more than 3 episodes, then we should give the antipsychotic drugs for lifelong. Then we have for psychological intervention, where we do insight facilitation therapy. Insight facilitation therapy meaning the patient will be unaware of the disease for himself. It's a psychotic disease. The patient will not have insight to the disease, that he is having delusions, hallucination, and all. He will feel that all these things are really happening. So we try to tell to the patient, we try to facilitate the patient to have the insight of the disease. It's called as insight facilitation therapy. And also we can give cognitive rehabilitation. Along with this, there is family psychoeducation, wherein which we tell the family members to reduce the negative expressed emotions towards the patient, like hostility, expressing frustration, anger towards the patient, passing critical comments on the patients, and over involvement in the patient's symptoms. So all these negative expressed emotions has been associated with the increase in relapse of schizophrenia. So we tell the family members to reduce negative expressed emotions, and we'll tell them to increase positive expressed emotions, that is warmth and positive reverse is been associated with reduced relapse of schizophrenia. So schizophrenia is a deviation in perception, thinking, speech, affect, and volition. The etiopathophysiciology of this condition, these factors, we have genetic mutations like 22q deletion and neuroregulin mutations. Environmental risk factors, we have maternal influenza, rubella infection during pregnancy, and obstetric complications. Stressful life events and cannabis use has been associated with schizophrenia. All these pathological factors cause impaired neurotransmitter level, that is dopamine level is increase in dopaminergic pathway in mesolimbic system causes positive symptoms. Decrease in dopamine in mesocortical system pathway causes negative symptoms. The serotonin increase or decrease causes positive and negative symptoms respectively. Then norepinephrine decrease is been associated with negative symptoms. Neuropathological changes are increase in size of ventricles and decrease in basal ganglia and limbic system size. Then we have psychological stressors like social stress, as well life events, and cannabis causing acute onset of symptoms of schizophrenia. The clinical manifestation, the diagnostic criteria given by DSM-5 is more than 6 months, the patient will have 2 out of 5 of these symptoms, that is delusion, hallucination, disorganized speech, disorganized behavior, and negative symptoms. Each symptoms should be present for significant time for at least 1 month. The positive symptoms are delusion, hallucination, disorganized behavior, disorganized thought and speech. Negative symptoms are anhedonia, apathy, avolition, affective blunting, alogia, asociality. The types we have simple, paranoid, disorganized, and catatonic schizophrenia. If the patient doesn't fit to these 4 categories, we tell him schizophrenia of undifferentiated type. Then under treatment, we have management, we have investigations to rule out organic causes. We perform neurological examination, CBC, LFT, RFT, EEG to rule out medial temporal lobe epilepsy, and CT and MRI to look out for ventricular enlargement and reduce cortical volume. Under treatment, we have pharmacotherapy, antipsychotic drugs like olanzapine, aripiprazole given for the duration of 1 to 2 years. If the patient has more than 3 episodes of schizophrenia, we should continue the drug for lifelong. Under psychological intervention, we have insight facilitation therapy and cognitive rehabilitation. Family psychoeducation, where we tell them to reduce negative expressed emotion like hostility, critical comments, and over involvement, to increase positive expressed emotions like warmth and positive reward. Thank you for listening.